Good afternoon. Thank you for joining us for today's daily briefing on coronavirus. I'd like to update you all on the government's plan to defeat the virus and on the latest developments. I'm joined once again by our Chief Medical Officer, Professor Chris Whitty, and the Chief Scientific Advisor, Sir Patrick Vallance. From the very beginning of this crisis, I followed the advice of our world-leading scientists to defeat coronavirus by taking the right measures at the right time. What everybody needs to recognise is that our NHS, like any world-class health service, has only limited numbers of doctors, nurses, and specialist equipment. So, the more people who become sick at any one time, the harder it is for the NHS to cope. And so it's vital to delay the spread of the disease and reduce the number of people needing hospital treatment at any one time. That's why we've given the clear instruction that people must stay at home unless they have one of the reasons we've set out. And with your help, we will slow the spread of the disease. I want to thank everyone who's been following the clear rules that we set out on Monday, and I want to thank everyone in the NHS, the front line of the fight against coronavirus, and of course, all our public services. Our teachers and our school staff, the transport workers, police officers, everyone who's keeping this country going. But I also want to offer a special thank you to everyone who has now volunteered to help the NHS. When we launched the appeal last night, we hoped to get 250,000 volunteers over a few days. But I can tell you that in just 24 hours, 405,000 people have responded to the call. They will be driving medicines from pharmacies to patients. They'll be bringing patients home from hospital. Very importantly, they'll be making regular phone calls to check on and support people who are staying on their own at home. And they will be absolutely crucial in the fight against this virus. That is already, in one day, as many volunteers as the population of Coventry. And so, to all of you and to all the former NHS staff who are coming back now into the service, I say thank you on behalf of the entire country. Now I want to take some questions, but finally I want to remind everyone of our core policy. Stay at home, protect the NHS, and save lives. Thank you. I think we'll go straight to questions now, and we are going to hear, first of all, I think from Laura Koonsberg of the BBC. Laura, are you there?
Thank you, Prime Minister. Yes. Prime Minister, can you honestly say that the government is coping? There aren't enough tests, people are struggling to make ends meet, and some people are being forced to go to work when they don't feel that they're safe. Is that coping? And can I ask the medics as well, if we already had the kinds of numbers of tests that you would like to see, how much of a difference would it have made to your ability to fight the disease?
Well, first of all, Laura, on the tests, a huge national programme of testing is being rolled out, but I'll hand over to Patrick and to Chris to say a little bit more about testing and how we're going to do it. But on the national effort to protect those whose jobs, whose livelihoods are threatened, I think everybody understands the challenge that the whole country now faces. But we have to get through this together, and we are getting through it together with an unprecedented programme of support for not just for businesses, but for workers of all kinds across the country. Never in our history has the government put its arms around people in the way that we are doing now to help them get through this difficult time. And yes, it is absolutely true that the measures to support people in employment are exceptional and extraordinary. 80% of your salary up to £2,500 per month were standing behind. We're also, in the course of the next couple of days, you'll be hearing more from Rishi Sunak, the Chancellor, tomorrow, about what we're doing to help the self-employed. And I think people do understand that the complexity of their working arrangements has meant that it has been harder to come up with the right tailored programme for the self-employed as well. But that is coming forward tomorrow. And yes, I do think that when you look at the sheer scale of what the government is doing to get this country through, we will, to answer your question directly, we will cope, and we are coping very well indeed under the most challenging possible circumstances. But the most important thing to enable us to get through it well together and to come out well together, as I think we can, as I know we can, is that we all follow the instructions that the government has given. Stay at home, protect the NHS, and that's the way to save lives. But on testing, perhaps, Chris, would you like to say some more?
In terms of testing, there are a variety of different things you use testing for, some of which we have tests available for and have done throughout, some of which we do not. So I'm going to run through them because they're different answers depending on which you're talking about. Starting off with the antigen testing, which is testing for people who've currently got a disease. We initially were using that to help screen people who came from high-risk countries. When that ceased to be a sensible policy, we've moved on to testing people in intensive cares and in hospitals, and we have sufficient tests for that at the moment. The system for that is working fine and is being scaled up. So that side of testing is in place and is working well. So if the patient gets as far as a hospital, we're confident on the testing and on the scale-up. The thing we would like to do next, which would certainly make a difference, less to the disease, but definitely to the NHS, is being able to test NHS and other critical workers who are self-isolating, who currently are not being tested because we do not have sufficient testing. And this is a global problem because basically every country is wanting this new test, which for a disease that wasn't actually being tested for anywhere three months ago. So everybody wants this. So there is a global shortage, and that's a bottleneck for us. But the next priority is to get critical workers back to work, or to say to them, you have got this. So we definitely would like that, not to fight the disease, but to support the NHS. Once we have more testing than we need for that capacity, then we want to go out to test a much wider range of people with mild symptoms. Some people are already having it as part of our surveillance system, but we would obviously like to go wider, but that's the prioritisation list. And then separately, there are the tests which we will want to have, which are not yet absolutely evaluated, but are going to be critical once you've got them, that can tell someone whether they have had the virus. So this is the antibody test. You can't do that in the first few days after someone's had a fever, but after a few weeks, possibly as short as 1 week. And that will allow us to be able to say to NHS workers, to other workers, look, you've had this infection at least for the short time and possibly for quite a long time. We think it's likely you're protected against this, and you can go back to work and be confident if you get another cough and fever, that is not going to be coronavirus. But that's a sort of technology that's quite close, and it's being evaluated this week, but it's not there. On the first one, our bottleneck is largely global shortages, which we are obviously doing our level best to free up, because it would make it a lot better for us to be able to test healthcare workers now, for sure.
Patrick, anything you want to add on testing?
Testing is crucial. It's absolutely crucial, and yes, we need more of it, as Chris has said. And the other thing that's going to be important with the antibody test is to be able to work out how many people have had the disease asymptomatically. And that's going to be important to understand what to do next. So these tests are crucially important. We need more of them, and people are working very hard to get them in place.
The one thing I finally add, I think, is the one thing that's worse than no test is a bad test.
Yes.
So telling someone inaccurately, either they have had it or have not had it, could lead to dangerous mistakes being made. So we do not want to go ahead with testing until we're confident of the technology.
And that is so important that if it means a delay to get there, that delay is worth having, because that is, as Chris said, if you tell someone it's okay, you haven't got it, and they have got it, that is not a good position to be in. If you tell somebody they're immune from it and they're not, that is not a good position to be in. So we must make sure that we get the quality of this absolutely right.
Just Patrick, on the numbers of people who have the disease asymptomatically, there was a study I saw quoted from some Oxford academics saying that as many as 50% may have had it asymptomatically, or I think a lot of people will have seen that story. How do you evaluate that at this stage?
We simply don't know at the moment, and that's why the antibody test is so important. So there are estimates that up to 80% or more of people in Wuhan weren't detected. There are estimates that of those who are positive, so that's a small percentage of the population who were tested positive, quite a number of them were asymptomatic in a town in Italy. But we don't know at a general population level, and that's why it's so important to get this test in place.
Thank you.